What's going on, guys? It's Greg here, and you're watching part 7 of the Nuclear Attack Survival Skills series. And in this part, I'm going to talk to you guys about decontamination and other considerations. So let's get started. So basically, I'm going to read you guys some information that I found from the Department of Health and Human Services. It has very good detailed information about how you should decontaminate yourself. It's kind of like a guide for medical personnel at hospitals, but it's very useful to you as a prepper and as a concerned citizen, a prepared citizen. It has good information in it, so let's get started. So basically, what the Health and Human Services Department says is that ideally you're going to want to have some kind of water source, because you're going to have to rinse everything off your body. So if you have a shower, that's ideal. If you have like a fire truck or something like that, that would also work. Or some type of like some type of a way that you can make a shower. Maybe you could take like a big drum and hold it up high somewhere on top of like a dresser, and then maybe like puncture a hole in it or something and let the water drain out. But you're going to want to have a water source. If you don't have a water source, you can still decontaminate yourself, but it's not going to work as well. The most important thing that you need to know, though, is that you can actually, according to the government, according to the Health and Human Services and the CDC, Centers for Disease Control, they say that you can remove 90% of the contaminants, 90% of the radioactive contamination on you just by taking your clothes off. So if they're right, then that just taking your clothes off and changing your clothes will make a huge difference. So basically, so I'm going to answer the first question is, why do you need to decontaminate yourself? The reason why is because when there's a fallout or some type of a radioactive explosion, there's typically some type of like a radioactive debris. If it's fallout, then it's going to be irradiated ashes. And the irradiated ashes, they land on you just like snow. Imagine like snow landing on your body, on your arms, on your on your jacket, on your head, in your hair. It's going to get in your hair. It's like snow, and except the snow is it's just like snow, except it's radioactive. And so you don't want that sitting on your skin, because it can do damage to your skin, number one. Number two, more importantly, it could be absorbed into your bloodstream, and then once it's absorbed into your bloodstream, it can contaminate your internal organs and cause all kinds of problems, cancer, DNA, leukemia, all that bad stuff. So you want to decontaminate yourself. It's critical. Decontamination is critical. If you get caught outside in a fallout, let's say there's a nuclear bomb and you didn't have time to get home and shelter. Let's say you're at a job somewhere and a bomb goes off, or there's some type of a nuclear emergency. It doesn't have to be a nuclear bomb. It could be a nuclear power plant, and there's fallout. And let's say you get caught outside. Let's say you're driving home and you get caught outside in the fallout. You get some dust on you. You're going to want to get that off your body. You're going to want to decontaminate yourself. So it's a very important thing that you need to know how to do that, because you're going to save your life. You're going to save yourself from having major complications down the road. If you don't decontaminate yourself, even if you survive, let's say you go outside and you get fallout on yourself, and then you go inside into a shelter, it doesn't matter if you're in a shelter, because you're covered in radioactive material. So that's why decontamination is important. You may also need to, let's say if you have to go outside and find resources. Let's say you're in your bunker for a few days and you ran out of food, and you have to go into your house, into your cabinets, and get more food or something like that. Or whatever the situation is, if let's say you have to go outside and during a fallout, for whatever reason you get caught outside during fallout, or you were close to a dirty bomb and you get covered in dirty material or something like that, you're going to want to know how to take basic precautions to decontaminate yourself. So the first thing you need to know, like I said, is that removing your clothing is going to take 90% of the fallout away. So that's the first thing you want to do, is you're going to want to take your clothing off any type of clothing, you want to take it off. And what you want to do is you want to put it in a separate bag, in a plastic bag, so you separate it from yourself and from your family, or whoever's around you, your dog. You don't want to like take your clothes off and just like put them in the house somewhere, and then they're going to be right next to where you are. You want to isolate them, put them in a bag, and separate them. If you don't have a spare change of clothes, let's say you only have one pair of clothes and it's cold outside or something, or it's cold in your house and you have to shelter in place in your house, like I explained in the previous video when I think it's part 5. Let's say it's cold in your house, your heat shut off, and you need clothing, and you only have one pair or something like that, or let's say you get caught in a city and you only have one pair of clothing. You're just going to want to brush your clothing off. You're going to want to brush it off, and that'll also get a lot of the radioactive material off. But ideally, you're going to want to take your clothing off, and you're going to want to change your clothing into something else, and that'll remove 90% of the radioactive contamination on you. But then after that, after you take your clothing off, you're going to want to do some other things. And what you're going to want to do is you're going to want to conduct decontamination in the following order. You're going to want to do whole body first, whole body decontamination first. Then you're going to want to take care of any type of shrapnel. Then you're going to want to do open wounds. Then you're going to want to do body entrance cavities, nose, mouth, and ears. And then finally, you're going to want to deal with localized contaminated skin. So remember in the previous video I discussed, in part 6, I discussed the importance of having a dosimeter and a survey meter so you can detect radiation. This is where it's going to come in handy, not only like all the reasons I discussed in part 6, but in this situation it's going to be critical, because what you're going to do is you're going to take your dosimeter or your survey meter and you're going to hold it next to your skin, and you're going to, once you take your clothing off, you're going to want to scan every part of your body. You're going to scan everything with your meter, and you're going to want to mark areas that with like a pen or something, areas where there's higher levels, and you're going to want to deal with those later on. But the goal of decontamination is you want to get the radiation levels on your skin no more than two times the background radiation. So typically, like, background radiation should be no more than 0.30 microsieverts per hour. So you want to get it below 0.60 microsieverts per hour, and it may take multiple times, for you to you may have to like wash your body, then measure everything again, wash again. It may take a few times for you to wash yourself before you get those numbers down. It may not happen all in the first time. It may take, a lot of washing to get everything off of you. And so some general considerations before we get into the details is you don't want to use very cold water, because what's going to happen is if there's any radioactive dust in your pores, the pores are going to close and it's going to hold the radioactive particles inside of your skin. So you don't want to use cold water. And then you also don't want to use hot water, because if you use water that's too hot, it can bring the blood to the skin more. And when you bring the blood to the skin, it can absorb the radiation into the bloodstream more. So you want to use like lukewarm water, maybe like 70 degrees, like lukewarm, typical like lukewarm water. You don't want to go too hot or too cold. Another thing is that you want to use soap. Soap is very good. You want to use soap for any kind of washing. You want to always use soap. You don't want to use conditioners. Stay away from conditioners. You don't want to use conditioners like for your hair, because conditioners will bind any kind of dust to your skin, to your hair. It's going to bind it to your hair. So you just want to use lukewarm water and soap for most things, for any type of skin washing. You don't want to scrub your skin too vigorously. You want to gently wash your skin. You don't want to like scrub anything, or you don't want to like scratch anything, or like do any kind of abrasive motions on your skin, because that could increase the absorption of the radiation into your body. So the skin is actually the protection. You want to keep your skin intact. You don't want to get cuts. You don't want to scrape yourself. You don't want to burn your skin with like hot water or anything like that. Your skin is going to protect your vital organs from radiation, so just keep that in mind. All right, so let's start then with, let's see, so you're going to start with whole body decontamination. You're going to scan yourself, and then you're going to mark, like I said, you're going to mark high levels. So basically what you're going to want to do is, you're basically just going to wash yourself like you're taking a shower. So once you remove all your clothing, you're going to rinse all your skin off with like I said, lukewarm water and soap. And what you want to do when you do that, you don't want to rinse it back onto your body. So like, let's say like when you take a shower, the water like falls on your head and then it comes down on your chest or your back. You're not going to want to do that. When you're rinsing your body off, you're going to want to try to rinse it off the body so it doesn't run down onto other parts of your body, because then it's just not going to be effective. So the best thing I would recommend you doing is you want to try to aim the water off your skin so it doesn't drip like onto other parts of your body, and you're going to want to use soap. It may take a few wash cycles to get the numbers down. So after you wash your whole body a few times, you're going to want to go in between. Every time you wash your body, you're going to want to wash your body at least twice. And in between washing, number one, you're going to want to isolate the wastewater. You got to make sure that the wastewater is rinsed far away from anywhere you're going to be, staying or habitating. You don't want to be like washing yourself and then like, being close next to that. You also want to take any kind of towels that you use to dry yourself off. You're going to want to take the towels and also put them in a bag with your clothing and isolate them away from yourself. And like I said, the wastewater from washing yourself, you're going to want to keep that far away from where you're staying, where you're sleeping, where your shelter is, where you're habitating. You're going to want to be that far away from that. You don't want to be near that, because that's going to be irradiated water. So after every time you wash yourself, you're going to want to, so the first time you're going to wash your whole body, then you're going to measure yourself again. And you're going to see if anything changed. And then you're going to wash yourself one more time and then measure yourself again. And hopefully you're going to be down to less than twice the background level. However, if you can't get it down below that level, sometimes it's just because the radiation is embedded in your skin, and extra washing may not necessarily help. So if you see like you reach like a plateau, then just don't worry about it. What happens is your skin is going to shed, your skin sheds constantly. The skin will shed off, or if there's any type of radiation embedded in your skin will just peel off and it'll slough off. So don't worry about it too much. If you start to plateau, don't panic, don't worry about it. It's just because the radiation may be embedded a little bit on the top layers of your skin, and your skin will just peel off, or the skin cells will just shed off, like a normal skin shedding. Let's see. It says, consider that attempts to remove all contamination from skin may not be feasible or desirable. Some radioactivity may be trapped in the outermost layer of the skin and will remain until normal sloughing occurs, about 12 to 15 days. Attempts at vigorous decontamination may result in loss of normal intact skin barrier and an increased risk of internal contamination. So if you can't get your radiation level down after washing yourself, don't panic. Don't try to like scrub yourself. Don't take like a rough, like one of those wash sponges. They're like kind of rough. You don't want to do anything rough. Even when you're drying yourself, you want to kind of just pat yourself. You don't want to like, vigorously dry yourself and kind of scratch the skin, because the more you scratch the skin, the more it's going to absorb. Let's see. Persistent levels of external contamination after adequate decontamination may also be due to internal contamination from radioactive foreign bodies, contaminated wounds, or contaminated orifices. All right, so after you do your gross body, you shower yourself, then you're going to want to deal with any type of radioactive shrapnel. You know, shrapnel doesn't have to be like a big piece of metal like in the, in Hollywood Rambo movie where he pulls a, he pulls a freaking metal out like this from his ribs, That may not be shrapnel. It could be, it could be obviously, especially if you're close to like a nuclear blast, but it could be small things. It could be like a little splinter, like a metal splinter, or smaller. There could be smaller pieces of shrapnel in your body, little pieces, like ½ inch or an inch. Of course there could be bigger ones, but, you also want to deal with the smaller ones as well. Because even though they're small, if they're radioactive and they're in your body, the blood is flowing through that foreign object, and your bloodstream is absorbing all of that radiation. So even small pieces, you're going to want to take it all out. So you're going to want to deal with radioactive shrapnel. You're going to want to pull them out, and after you pull them out, what you're going to want to do is, let's say I have like shrapnel here in my hand, I pull it out. What I'm going to want to do is I'm going to then want to rinse the wound out a few times with the same thing, with lukewarm water, not too vigorously so you don't damage your tissue. You want to just rinse it out, so gently, and just do it a lot. It may take a little while to get the radiation contamination out of the wound. And you're going to want to cover up the areas around where the wound was, because you already obviously, took a shower and decontaminated yourself. So you don't want to, try to start rinsing your wound out, and then it's going to come back onto your skin and you're going to be back again contamination. So you're going to want to drape some type of, either like a waterproof dressing, some type of like a waterproof material, or even just like towels or some type of material, so when you're rinsing the wound out, it's not going to get on your skin, the radioactive irradiated particles and water. It's not going to get on your skin. So you're going to want to irrigate any visible. You're going to want to remove visible foreign bodies such as metallic fragments or shrapnel. It's going to take multiple irrigation attempts are usually necessary. You want to irrigate the wound gently with copious amounts of water or saline. Cover the skin surrounding the wound with waterproof dressings or drapes to limit the spread of radioactivity by water runoff during wound irrigation. Let's see. Is that it? I'm just going to check and make sure. All right. So and then after you wash the wound a lot, with a lot of warm water, lukewarm water, and a lot of water, you're going to want to measure the wound and see if the radiation's high. If the radiation is still high, you're going to want to obviously get that taken care of at some point when you get to a doctor, You don't want to just ignore that. So, all right, so we did whole body, we did the shrapnel, and now we're going to do open wounds. If you have any open wounds, it's important that you wash them out. Let's say you have a scratch, even a small scratch, or if you have like a large laceration, something like that. Even if you just have like a scrape, you scraped something, however small or however big, you're gonna wanna rinse any type of open wound. And you're going to follow the same procedures as you did with the shrapnel. You're going to want to cover the area around the wound with some type of a drape, a towel, waterproof dressing, whatever, improvise something, whatever you have around you. You can use, you could even use like a trash bag. You could take trash bags, and you can take rubber bands, and you can rubber band some trash bags around your arm. Let's say you have a wound here, let's say I got a cut here or something. I can take trash bags and just take rubber bands or whatever, even just some cordage, and I could tie it with some cordage, some rope. I can tie a piece of plastic garbage bag on my forearm here, and then tie it up here, and then I can just rinse the wound out, in this direction, so any kind of runoff is going to go down to the ground. It's not going to go back on my arm here or here. All right, so try to improvise, whatever you have around you. Garbage bags are waterproof. You can definitely use those. So, garbage bags and rubber bands, or some type of cordage. Let's see, what else? Irrigate the wound gently with copious amounts of water. You're going to want to monitor the wound with your survey meter after each irrigation attempt. You may also want to swab the wound with a sterile cotton swab. You may want to swab it so you can measure the radioactivity, but that's kind of more for like medical personnel. So we dealt with the open wounds. So now we just got to do body cavities and localized skin. So we're almost done. So then with the body cavities, your ear, nose, and mouth, those are obviously entryways to your body. So if you have any kind of radioactive dust that, let's say, it got in your ear, or it got in your eye, or it's around your eye, or your nose, your mouth, you're going to want to gently clean that off, without flushing it into your body more. So let's see here. So if you have like cotton swabs are really good. You can take cotton swabs and put them in your nose, and you can clean your nose out that way. Same thing with your ears. You can swab your ears gently. You can also rinse your ear canal out with water, with a high strength, as long as your eardrum is intact. If your eardrum is not intact, then you don't want to rinse with water. But if your eardrum is intact, then you can actually use one of those things that they use to clean your ears out for earwax, or you can just you can tilt your head and let the water from the shower go into your ear and just rinse everything out of your ear, and just do that a lot to get everything out of your ear, Same thing with your eye, You're going to want to rinse your eye out, but the key with rinsing your eye out is you don't want to rinse it towards the inner part where your tear ducts are, because then the radioactive particles can get lodged in your tear duct. So you don't want to do that. You want to rinse it the other way, away from your tear duct. And if your eyeball is not if your eyeball is punctured, or you have some type of your retina or something like that is punctured, you're not going to want to rinse your eye, because there's a chance that the particles can get into your eye, deep inside your eye, and they could cause complications, So if you have any kind of things in your eye, like something is puncturing your eye, you're not going to want to rinse your eye out, vigorously or anything like that. But if your eyes are okay, rinse your eyes with water, and rinse them away from your tear duct. You want to keep your tear ducts away from any kind of wastewater or rinsing. You don't want the particles to accumulate inside your tear duct. And then your mouth, you can brush your teeth. They say here that it says here, let's see, encourage toothbrushing with toothpaste and frequent mouth rinsing. Encourage gargling with 3% hydrogen peroxide solution for pharyngeal contamination. So basically, if you suspect that like your throat, is contaminated or something, let's say you breathed a little bit in and there's some dust in there, you're going to want to gargle with hydrogen peroxide, and you're going to want to keep gargling as much as you can, Same thing with your mouth. You're going to want to brush your teeth very often, because your teeth, there's a lot of crevices in your teeth, there's a lot of small spaces. You have your gums, so if there's any kind of radioactive particles in your mouth, they can get lodged in between your gums, under your teeth, in between the different crevices in your teeth. So you're going to want to brush your teeth a lot, and you want to make sure that you're getting everything out. Same thing with your mouth. You want to rinse your mouth a lot if you have mouthwash or water. Even if you don't have toothpaste, just brush your teeth with water. That's better than nothing. But ideally, toothpaste will be best. Let's see here. Oh, and then when you irrigate your eyes, when you're washing your eyes out, you're gonna want to check for conjunctivitis after some time after decontaminating. You're gonna want to check for conjunctivitis. And then there's hairy areas. You're gonna basically want to, when you're doing that, you want to use shampoo and soap, or shampoo, but you don't, because what it says here is soap or shampoo emulsifies and dissolves contamination. It says conditioners should not be used because they can bind radioactive material to hair protein, making decontamination more difficult. Direct contaminated wastewater away from patient rather than over the rest of the body. Avoid getting contaminated wastewater into eyes, ears, nose, or mouth. So the key is, like, when you're rinsing your hair off, you don't want to recontaminate your nose or your eyes or your your ears, your mouth, because when you're washing your hair, it could run back on your face or in your ears. So what you're going to want to do is you're going to want to do it like in the haircut places, when women go to like a salon, or you go to like a really higher end hair barber, and you lean your head back in the sink. You know how they have those special sinks with the notch in them for your neck. You put your head back and they can rinse your thing. So ideally, if you can find like a little sink or something, or some type of a tub, if you had like a tub or a bucket, and you could tilt your head back and then have somebody rinse your hair, have it rinse it, and just and maybe put a towel on the back of your head, so if anything runs down your neck, it's not going to go down your back, but you're going to want to like tilt your head back and then rinse your hair down this way, and you want to be very careful that the water doesn't go back in your ear or in your eyes or in your mouth or in your nose. You could even wrap a towel around your ear, or protect your ears, so if the water doesn't, so if, let's say, a little bit of water comes, the towel will protect your ears. You can even cover your eyes too with the towel. Who's to say you can't do that? Just because it's not written in this paper doesn't mean you can't do that. You can cover your whole face with a towel, and just have someone gently rinse. So then finally, we're gonna get to localized skin. So remember, in the beginning I said you're going to want to mark areas of your body that have high contamination. You're going to want to deal with that. Like the areas I said, if you had like when you use your survey meter, if you have one. If you don't have one, then obviously this isn't going to apply to you. But if you have your survey meter, I told you to mark the areas where you have high levels of radiation, and you're going to want to go back to those now, and you're going to want to deal with them. So let's see what the government says. They say here, begin decontamination with areas of the highest contamination levels. In a water deficient environment, gently brush skin surface to remove a portion of the stratum corneum layer and dislodge contamination held by skin proteins. So basically what they're saying is they want you to gently brush the skin where you have those highest levels. You're going to start with the highest levels, and you're going to brush it gently. You're going to brush your skin, and what that's going to do is it's going to gently remove the top layers of your skin. Obviously you don't want to brush too vigorously, because if you brush too vigorously, you're going to break the skin, and you're going to expose your bloodstream to the to the radiation. So you're going to want to gently brush your skin to get the top layers of your skin, because the radioactive particles may have embedded themselves with the skin, so you're going to want to brush it off. In a water sufficient environment, wash patients with tepid water and soap without damaging or abrading the skin. Add mild soap to water to emulsify and dissolve contamination. Direct contaminated waste away from the body. So same thing. When you're doing this, when you're dealing with your localized areas, you don't want to recontaminate yourself. So you're going to move the water away from you. Just like before. Let's see what else. So like I said, with a water sufficient environment, you're going to want to use warm water, lukewarm water, and soap. And if there's a water deficient environment, if you don't have water, then you're just going to want to gently brush the top layers of the skin to hopefully try to dislodge the radioactive particles. So let's see. It says stop localized skin contamination efforts after 2 cycles. So you're not going to want to do more than 2 cycles. So you're going to, let's say, brush, and then you're going to check again with your meter, and then you're going to brush again, and that's it. You don't want to do too much, because then you can damage the skin. It It says here, attempts at vigorous decontamination may result in loss of normal intact skin barrier and an increased risk of internal contamination. So that's basically it for decontamination. You know, and same thing with the localized skin. You're going to want to make sure, you know, any type of bandages or anything that you used, you know, you're going to want to separate it. Wastewater, towels, bandages, all that stuff, you're going to want to separate it and throw it in a bag and get rid of it or keep it away from you. Oh, and another thing with the wounds, with the radioactive shrapnel and the open wounds, you're going to obviously want to put a bandage over the wound as soon as you wash it, so it doesn't get recontaminated. That should be common sense. And another thing you can do is when, you know, because let's say you're washing somebody else or you're washing your own body, you're going to get, your hands are going to get, you know, soiled with radioactive particles and wastewater, you know, because you're going to be washing your hair or you're going to be rinsing your body off. You know, you're going to be doing all that. Let's say you're washing someone else's hair or whatever. What they say you can do to actually get rid of some of the particles on your hand is you can keep some rubber gloves on for a while to promote sweating, like you typically, like surgical gloves or, like, you know, rubber nitrile gloves, latex gloves. You wear them for a while, and what it'll do is it'll promote sweating on the hand, and the sweating will rinse the skin off of any kind of you know, radioactive particles. So basically, I'll just quickly recap the decontamination sequence. You're gonna start with your whole body. The first thing you want to do is take your clothes off. Then you're going to want to shower with, you know, mild soap and lukewarm water. You don't want to go too cold or too hot. You don't want to do any kind of vigorous brushing. You don't want to damage your skin. You want to keep your skin intact. After you do your whole body, then you're going to go to shrapnel. You're going to pull shrapnel out of your body, and then you're going to rinse the wounds out, and you're going to be careful not to recontaminate the rest of your skin. You're going to want to cover your skin with some type of a dressing, waterproof barrier to protect your skin from recontamination. You're always going to want to direct the wastewater away from your body. You don't want to recontaminate yourself. After you remove shrapnel, you're going to take care of any wounds. You're going to flush wounds out with the same thing, lukewarm water and soap. You're going to flush the wounds out, and you're going to want to make sure that you don't recontaminate surrounding areas near the wound. So you're going to want to wrap your areas around the wound with plastic bags or some type of a towel. You're always going to want to separate any kind of wastewater, towels, bandages, anything like that that's contaminated. You're going to want to separate it into a separate bag and get rid of it or keep it away from you. After the wounds, you're going to want to deal with your body cavities, your ear, nose, mouth, and eyes. When you're washing your eyes, you want to make sure you don't flush the particles towards your tear duct. You're going to want to rinse this way, away from your tear duct, you know. So if you're looking at me right now, rinse away from your tear duct. With your nose, you can use swabs to clean your nose, cotton swabs. Brush your teeth frequently and rinse your mouth. Gargle your throat often with hydrogen peroxide. Rinse your ears out with water, you know, as long as your eardrum is intact. And then after that, you're going to want to deal with the localized skin that's in the high areas of localized contamination. You're going to want to, if you don't have water, you're going to want to brush the skin gently to remove the top layers of the skin, you know, without obviously injuring yourself. You know, you're just going to brush the dead skin off. And then if you have water, then you're just going to want to rinse it with lukewarm water and soap. So that's basically the decontamination process. And now I'll just give you guys some general considerations to keep in mind. If you're going to be going out, let's say you're going to want to make sure that you don't drink radioactive water, because you know, depending on what your water source is at your house or wherever you are, you want to know if the water is going to be contaminated or not. See, like my house, I have a well, and my well is, you know, pretty deep. It's 600-foot well. So my water's deep, you know. I'm not worried about radioactive contamination here at my house. However, if I'm in a city environment, you know, and the water may come from a local reservoir, or, you know, it may come from some other source, chances are the water may become irradiated, you know. even because the water is sitting in the pipes under the streets or in the house, the water may become irradiated, and then so you don't want to drink irradiated water. And this is where having a radiation meter comes in handy. Like I reviewed in the previous video, I mentioned that in the essential gear video, because you can measure the water with your meter. You can hold the meter to the water and you can see what the level is. You know, if you don't have a meter, you're not going to know. So you want to avoid ingesting any type of contaminated food or contaminated water. You know, if you're going to like try to hunt for food, you know, you're not going to really want to eat like a deer or any other kind of animal that's been out in the fallout, because the meat is going to be contaminated, and when you eat it, it's going to go into your stomach and you're going to have problems. It's going to cause cancer, whatever. It's going to mutate your DNA, leukemia, all that bad stuff. So you don't want to ingest any type of radioactive food or radioactive water, and this is where having that dosimeter and survey, any kind of you know, detection meter that can detect radiation will come in handy in this situation. Let's see, is there anything else? So I think that's it. So I covered decontamination. I'm sorry it's kind of a long video, 36 minutes already. I'm sorry it was long. I just wanted to cover everything. I'm gonna post links in the description for where I got this information from, if you want to read into it yourself, and if you want to print it out and have it as a reference. I printed it out and I have it as a reference. I keep it in my one of my cabinets. I have like a medical area where I have medical books for like first aid, you know, how to deal with different, you know, common illnesses and stuff like that. I printed this information out and I keep it there just in case, you know, if I want to reference it or something. So that's it, guys. I hope this helped you out. Thanks for staying with me. I know it's a long video. My videos tend to be long. I know that. I'm gonna try to shorten my videos, but certain videos I want to, you know, squeeze a lot of information in it. It's really, you know, it's hard for me to cover everything and provide enough information, you know. So sometimes a long video is unavoidable, unfortunately. I know people these days, they don't have patience, you know. They want to, you know, they want to be able to just freaking touch their smartphone and everything is there right in front of them, but sometimes that's just not the way it works, you know. Sometimes you got to have some patience and you got to sit through things. So thanks for sticking with me. Thanks for subscribing to my channel. Thank you for commenting. I appreciate every comment that you guys leave. I try to read every one of them. I really enjoy reading your opinions, as long as you're respectful and you don't use bad words. Please don't curse on my channel. There's nothing that I dislike more than cursing. There's no reason to curse. You know, speak like a civilized person. There's no reason to use the F word or any other kind of word. You know, speak like an adult. You know, if you're an adult, talk like an adult. You know, don't call people names. And I appreciate everything you guys do, all your opinions. I really value everything. So please continue to, you know, contribute to this channel. Please continue commenting. Let me know what you think about my videos. If you want to see something specifically that interests you and you want me to cover that topic more, or if you don't like a certain topic, you know, give me some feedback. So thanks for watching, and I'll see you in part 8. You can click on the bottom of the screen and it'll take you to part 8. So see you over there. Alright, God bless. Bye.